are in the emergency department. We are a 16-bed emergency department. The nice thing about Upper Bucks is we are a trauma center, so we do get trauma patients, all kinds from small little finger lacerations all the way up to big bone injuries. We're also a stroke center, so we do see patients that have strokes, and then we see every age possible from infants all the way up to geriatric patients. So this is one of our emergency department rooms. As you see, all of our equipment sits on the back wall, and then we have a monitor, which is where the camera is at. So every patient gets hooked up to this just so we can assess their vital signs and see what kind of further care they need. Every room has a stretcher. When patients come in, we do ask them to remove at least their shirt, and we put them in a gown just so they are ready for the physician to be assessed. This is our computer. This is where we do a lot of our charting at. Everything is done electronically. We don't use paper anymore in the department, so everyone can assess their medical record when needed. So teamwork is the reality of the ED. So as you watch TV shows, you will definitely see a lot of people in rooms. That does happen most of the time. So a sick patient comes in, we never know what's coming through our door. So we definitely need to have teamwork. So we have registered nurses, we have physicians, and we have what we call ED techs, who are helpers at the bedside. What you see behind me is my nursing staff. So these are registered nurses. So they are most likely charting at the computer. All our rooms are filled in the ED at this point. So they go in and do their interventions in the room, and then they will come out to the computers and document what they are doing. You might see our techs who are in green walking around. So they do a lot of our small things like get blood sugars. They clean our rooms for us. They walk patients to testing areas. And then you might see some physicians as well who go in and see every patient and determine the plan of care for the patients that we are seeing in our department. So this is our doctor box is what we call it. So this is where our physicians and our advanced practitioners sit to do their charting. So they do go outside the box to the patient's rooms to see the patient. Then they will come back here to the computer and put their orders in and put their notes in. Once again, everything is electronically documented. The ED has lots of opportunities. So we have our ED techs who needs a high school diploma. After that, there's really just on-the-job site education and training. If you want to become a registered nurse, that is a college degree. So we have anywhere from a diploma, which is a 2-year course, all the way up to your bachelor's, which is a 4-year college degree. So we do accept any of those degrees within our ED as registered nurses. And then we also have physicians in our department. So along with advanced practitioners. So those are, again, more college, but they do help us in our department and are part of our team. Once you have your high school diploma, we definitely can give you a budgeted position in the ED. That would be an ED tech. We also have volunteers. We love our volunteers. They are very helpful. They do a lot of our stocking in our emergency room. They round on our patients, just make sure they have their needs. So that can be at any age, high school age students. So if you have or want the opportunity, please seek us out because we are always looking for volunteers to help us. The ED is a very safe place, especially during COVID. As you see, we wear all our PPE. We're probably one of the safest places out there to come to because we wear our PPE for every patient. So again, we're a safe haven. Anyone can come. We will treat anyone or give you the resources you need to get the care elsewhere.
Radiology is really a combination of art and science. You're the photographer. You're the photographer for inside the body, so that's the kind of art part of it. And then you go into the science. You have to be able to figure out how to get that best picture of the patient. So there's a lot of physics, there's a lot of anatomy involved. It's a great modality, a great area for people that kind of want a little bit of the science and the healthcare, but then they're also a little bit more interested in the art of the human body. We do all sorts of imaging here, from MRI to CAT scan to ultrasound, X-ray, outpatients, inpatients, ER patients, all sorts of different procedures that we do with our radiologists. So all the imaging procedures at the hospital. As we have patients who are what we call walkie-talkies, they can walk in and take care of themselves. We have patients in wheelchairs, we have patients that come by stretcher from other facilities, patients who are with caregivers, lots of different patients and different abilities that they can handle.
All right, so we're looking at a CT scan of the abdomen and pelvis that was done on a patient here just a few minutes ago who was having some abdominal pain. And what we do is we use radiation to kind of differentiate the different densities inside the body. So we have the spine here. You can see the kidneys here. Here's the liver. And we can see some bowel loops. This is tiny little guys, the appendix here. And we can use this to diagnose all sorts of illnesses in the abdomen and pelvis, ranging from illnesses of the viscera, like the liver and kidneys, to illnesses of the bowel. And it can be trauma, it can be neoplasm, cancer, oncology stuff. This is just one of the things that we do. We do a lot of different imaging here, and we do CT, ultrasound, X-ray, MRI. Any one of those cases can come to us at any given time, and we can all look at those cases on our screens here that we get from what's called the picture archiving system that holds on to all the images, and we can pull them up. So they're all available to us, and that's pretty much what we do all day. For being a radiologist is a subspecialized form of being a physician. So you go through the regular pathway of high school, college, medical school, and internship, and all of that is just like if you were becoming a family doctor. And then you go into your residency, and now you're subspecializing in this particular kind of medicine where you're sitting in front of a monitor and you're no longer interacting with patients nearly as much as you were when you went into medical school and you started your training. And so that is a big difference from what you would experience if you wanted to go into cardiology or family medicine. You're just not that much in contact with patients, but on the upside, you get to see a lot of patients in a way because you can see scans much faster than a doctor can see a patient. So you get exposure to a lot of pathology and a lot of science. So if you're really a science-focused person and maybe not as much of a people person, this might be the way to go.
So it is a college program that you need to attend. There's 2-year degrees, there's 4-year degrees that you can come out with. The 2-year degree is an associate's, the 4-year is a bachelor's. There are many different programs out there from 4-year colleges, community colleges that have programs. There used to be hospital-based programs, but I'm not so sure that they're very full anymore. But a degree through a college is what you need to do. This is the MRI department, so we scan outpatients and inpatients, ER patients in this area. We scan everything from the head all the way down to the toes. Great modality for orthopedic work, for looking into the abdomen, pelvis, the brain. We do a lot of stroke patients. Lots of computer work in this modality, lots of time on the computer, but patient care skills are tremendous in here. These two have the patience of a saint. They work with patients who are very claustrophobic at times, and that can be difficult, and you have to have the compassion to be able to do that. With any kind of X-ray modality, you start with X-ray, general diagnostics. So this is the area you would start in. From there, you can branch out to CAT scan and learn an advanced modality. You can go straight into ultrasound school. You do not need to go to X-ray school before going through ultrasound. And there's a lot of on-the-job training that can happen within the hospital. We have partnered with Northampton Community College and have a program where we have a cross-training program where X-ray techs can cross-train into CAT scan. We have mammography programs, different areas where you can go from there, but you do need the X-ray program prior to CAT scan and mammography. We are looking at a brain MRI scan. What you're seeing are the lines are the planning sections, so that is where we're telling the computer to actually scan through and what directions to go.
What's available to them right now?
We love to have them. They are volunteer opportunities where they can come in, They'll work in our department, shadow our technologists, do different things to help them during the day, and then they can get a good view of what goes on during the day.
We actually are the department that services the food for this hospital and also the Quakertown campus. So we do 2 locations. You see the tray line in session. This is for the 2nd floor. My team is pulling the items that are on these tickets that the hostess rang in for each of the patients. This is the only thing that the patients really have control over, is what they consume every day, and that's a really important thing to keep in mind. The patient's care is the patient's care, but this is something that they have total control over. So the team is making sure that all the items are on the trays and checking them off. Right now we have our dinner tray line in session. It's for the Upper Bucks campus. It started at 4 o'clock and we feed all the floors here. So before 4 o'clock, actually, we have our tray line for the West team over at Quakertown. And so we have the dinner tray line for them and then the dinner tray line for here. Right now I have 7 positions that are available, and all of those positions are for nutritional service aides. And our nutritional service aides are doing exactly what you're seeing behind me. They're getting the trays ready for the patients and then delivering them upstairs. We also take the patient's orders. So as far as learning diets and learning, flu restrictions and things like that, those are things that my team learns on a daily basis and are able to execute that. We have fed up to 80 patients here at Upper Bucks, especially when our numbers are high in the emergency department. Business management would be what I would say for myself. That's where I went, and a lot of years of experience. So just time served, come in, you're young, learn it now from the ground up. I have team members that are graduating to be dietitians. I have ones that are graduating to be the OR nurses, and they have a internship right here at the hospital. Kathy's done over 40 years at St. Luke's. It's been, 20 years?
Around there, a couple restaurants.
Yeah, so she has a lot of experience.
Yeah, explain, who do you hire? Who gets jobs here in this department? You said experience. What kind of experience?
Well, we're looking for those that, have food service experience. It's not 100% necessary, but it is a nice thing to have, especially as the tray line cook. So experience with making sure that we're serving food to temperature, all of our fish, chicken, and any beef is served correctly. It's a very important role. We are open 365 days a year, so it's super important that we have reliable and trustworthy team members that are here to ensure that the patients are taken care of. I think the misconception is that there's downtime. We are busy all the time. It is a go, go, go department. We do a lot for not just here, but the staff of both campuses, the community, the care nows, and other facilities as well.